Thank you, Leanne. Thanks for having me.
All right, so this is, I suppose, an education to a lot of people that you can actually pick up illnesses through looking in your mouth.
Yeah, you know, we're definitely trained to look at certain telltale signs in the mouth. As you mentioned, anemia can be picked up if we see that the tongue is quite swollen, it's smooth looking, it's red. We also see if you have appearance of angles of the mouth that are a little bit inflamed, that can definitely indicate that you may be suffering from anemia. So if we pick up on those signs and you haven't been diagnosed, we'll obviously advise you as a patient to go and have yourself medically checked out by a general practitioner. Also, if you're looking at the gums, if we see that the gums are generally in a bad condition, we look at something called periodontal disease, which is a disease of the tissue around the gum and the bone. Also, a bad breath, that can indicate that you may be suffering from diabetes. So definitely, we look at certain signs in the mouth, and that can indicate that there might be an underlying cause. For instance, if you have mouth ulcers, if you have a dry mouth, again, bad breath, that can indicate that you may be suffering from some form of gastrointestinal disease, for instance, like Crohn's disease, which is an inflammation of the gut. So definitely, you know, we can pick up on signs in the oral cavity that can lead us to think that there may be something else going on in the body, and then advise you accordingly.
Is this common practice? I mean, I can safely say I've never really been to a dentist who's sort of looked at other aspects other than my teeth. Is this new, or is it something that's been around?
It's certainly, I wouldn't say it's too common, but you know, we definitely can see links between oral conditions and your general systemic health. Yeah. So I think the two definitely are intertwined, and they overlap in many aspects. So yes, it is not our job only just to focus on the head and neck and the teeth, but we can also indicate to the patient that something else that they may not know about might be going on. You know, generally though, we see that people who don't look after their mouths generally don't look after their body, so to speak. So there is definitely a link in your own health and in your oral health.
Yeah. Well, let's talk about dental health care, because, you know, we've always been told brush your teeth twice a day, visit the dentist regularly. Yeah. Talk to us about this. I mean, firstly, should we brush twice a day, and how often should we come to the dentist?
Okay, so look, I think a nice message for the viewers is just to get into a very good home routine. A lot of your oral health can be really done at home. So if you stick to a good routine, like you mentioned, brushing twice a day, that definitely has its benefits, especially at night before bed. You want to go to bed, Leanne, with the cleanest possible mouth. And obviously the reason for that is during sleep, your salivary glands subside. There's a diminished salivary flow. Some people actually sleep with their mouth open. And that can lead to, obviously, problems during the night. So the principle is go to bed with the cleanest possible mouth. So brushing before bed, absolutely imperative. And flossing, using dental floss, it's a horrible word. People don't like to hear it too often. It's one of these stigmas. No one likes to do it, but really there's huge benefits to flossing. And if you do a little test tonight before you go to bed, after you've brushed for 2 minutes, just floss and just see what comes out from between your teeth. You'll be quite horrified. Definitely combining those two, brushing, flossing, using a mouthwash, that is an excellent nighttime routine. Obviously in the morning, not many people want to leave their house without brushing their teeth, so you're going to blend that into your routine, and obviously that's going to help keep your, what we call just the pH or acidity level in your mouth as low as possible. That's the key here. You want to create a real neutral environment in your mouth where decay is not going to onset itself. So brushing morning and night, flossing, using a mouthwash, strict home routine really will keep you nice and healthy for a very long time. And then, as you mentioned, you know, going to the dentist, it's important just to make sure that you're doing the right things at home. So, you know, once, twice a year, visit your dentist. But I think more importantly, Anne, is have your teeth cleaned. Go to an oral hygienist at least twice a year.
Okay.
Have your teeth cleaned, because that obviously you're gonna get to points every 6 months where there'll be a build-up of plaque or what we call calculus that you won't be able to remove at home, and then the professional, either the oral hygienist or the dentist, will intervene.
Yeah. All right. Yeah, it's interesting. I mean, it's vital facts that we all need to know, but I suppose it's good to be reminded of what to do. Let's talk about children, because I mean, obviously this it must be ingrained from a very, very early age. What age should kids start brushing? From the day they get their first tooth, I should say.
You know what? It's a very interesting topic. I think for toddlers and for kids, there's a 4-letter word that I really I try and drum into my patients and the parents, and that's diet. If you control what your child eats and drinks and you reduce the sugar intake, you really allow them to have a better chance at preventing decay. Not every kid is going to be able to brush correctly. It's going to be a challenge. It's going to be something that you're going to have to show them and teach them throughout their young years. From as little as 4 or 5, I would say, regular brushing should be introduced. Even younger than that, I mean, the first teeth will cut at about 18 months, and at 2 years, you'll see the full dentition out. To brush a child's teeth at 2 years, as a parent, that it's really difficult. So back to that 4-letter word, diet. Keep the diet sugar-free, keep the diet healthy, and you'll obviously lessen the burden on the child's teeth. Yes, obviously make brushing a family event when they're young, parents and kids brush together, make it enjoyable so that they do develop good habits at a young age. I advocate that bring your kids in from as little as 3, 4, bring them to the dentist, even if it's just a 5-minute visit. They get to play in the chair, see the lights, see the tools, get used to the environment, so that when something does happen, it's not a new environment for them and it's not such a shock. So those are little things that you can implement as in a toddler at a young age will really put them into a good position going forward. And I think my adult patients that are all fearful of the dentist unfortunately had a bad childhood experience in the chair. So that's something we as professionals try and reduce. We try to limit that so that obviously as we grow up, we're not scared of the dentist anymore, which is something we have to deal with.
Yeah, indeed. I tell you, it's a comforting thing. I mean, if you're comfortable in the dentist, and it's vital for your health. But let me tell you, to try and get a 2-year-old to brush its teeth is one of the biggest challenges ever. It really is. I'd rather climb the mountain behind you. It's easier.
You know what you can do? If parents are struggling, just take a cloth, put it over your finger, and just get a tiny bit of obviously baby toothpaste, the toothpaste indicated for 0 to 2 years old, which has no fluoride in it. So just a cloth over your finger, a little bit of toothpaste, and just rub that on their teeth. That's fine. That's absolutely fine for that age. And as they get older and become more mature, so you can start introducing a toothbrush and as I said, making it like a fun thing to do.
Yeah. Well, listen, I think you've given us a lot of food for thought here, and I think the earlier you start looking after your teeth, the better. And also, I mean, I'm quite amazed by what you can find out by just having a good mouth examination. Lots of secrets lying in our mouths.
Absolutely.
Yeah. Thank you for talking to us, Dr. Marc Sher.
It is indeed.
Yeah, awesome. Thanks for talking to us. In our Sea Point studios, Dr. Marc Sher. He's at the dental practice in Sea Point, Cape Town. All right, let's take a break. We'll see you.